What if a key to improving our most advanced cancer treatments wasn't found in a futuristic lab, but in ancient medicine? Well, a new study is exploring just that, bridging these two worlds to take on one of oncology's greatest challenges. So, can ancient wisdom really improve modern cancer therapy? This is the huge question at the heart of this groundbreaking research. For years, the role of traditional medicine in modern care has been this big debated topic. But now we finally have some of the most solid data we've ever seen to help find an answer. Okay, to really get why this research is such a big deal, we first need to understand the challenge we're up against. And believe me, it is a truly formidable foe. We're focusing on something called Stage 4 non-small cell lung cancer, or NSCLC for short. This is the most advanced stage. It's when the cancer has already spread to other parts of the body, which, as you can imagine, makes it incredibly difficult to treat. And this number right here, really says it all. 5.2%. According to the research, that is the 5 years survival rate for these patients. That single, stark number shows you exactly why the search for better treatments is so urgent. Now, you might be thinking, but we have all these amazing modern treatments. And you're right. Targeted therapies have been a huge step forward. But here's the catch. They face some pretty big hurdles. Cancer is clever. It can learn to resist drugs over time. And these powerful treatments often bring on some severe side effects. We're talking everything from rashes to serious liver and kidney issues that can really tank a patient's quality of life. And this is where the study introduces a potential and maybe overlooked partner in this fight: Chinese herbal medicine, or CHM. It's been used in Asia for centuries, but its role in modern oncology has always been a bit fuzzy, mostly because there just wasn't enough rigorous scientific proof. A lot of patients already use CHM right alongside their conventional treatments, hoping to manage side effects and just feel better. But the million-dollar question has always been, does it actually help them live longer? The hard, long-term data on that, well, it's been missing. Okay, just look at this. This slide shows you why this new research is such a game changer. Past studies, they were small, short, sometimes followed patients for barely a month. This study, it's massive. We're talking nearly 6,400 patients followed for up to a decade. And they use this really smart statistical method called target trial emulation. Basically, it lets them analyze real-world data with the same kind of rigor you'd see in a clinical trial, which makes the findings much more reliable. All right, so the big question, what did this massive 10-year analysis actually find? Well, the results are pretty eye-opening. Let's start with overall survival. Get this. After carefully balancing the groups, patients who used CHM as part of their treatment had a 10-year survival rate of 8.2%. For those who didn't, just 3.4%. I mean, that's more than double. Just let that sink in for a second. And it gets even more dramatic when you look specifically at deaths caused by the lung cancer itself. The 10-year survival rate for CHM users was 11.5%, compared to just 4.4% for non-users. That is a huge difference. But the researchers didn't stop there. They drilled down even deeper to ask, okay, but who is benefiting the most? And they found something fascinating. The biggest benefit was in a very specific group: patients with the most common subtype of lung cancer, called adenocarcinoma, who are also taking a modern targeted drug called an EGFR TKI. This is one of those smart drugs designed to attack a specific genetic weak spot in the cancer cells. And what they found was a powerful synergy between old and new. Now look at these numbers. For patients on that targeted drug alone, the 10-year survival rate was 5.3%. But when patients combined that exact same drug with Chinese herbal medicine, the survival rate jumped all the way to 9.6%. This is the crucial point. It seems the herbal medicine isn't just helping on its own. It appears to be actively boosting the effect of the modern therapy. So, of course, this brings up the next huge question. How is this happening? What's the biology behind it? To investigate this, the researchers turned to a really cool, cutting-edge technique called network pharmacology. The best way to think about network pharmacology is like creating a biological roadmap, or maybe a Google Maps for ourselves. It's a way to take the hundreds of active compounds in these herbs and figure out all the different biological pathways and networks they might be interacting with inside our bodies. And what that map showed was a potential complementary action. Think of it like this. The targeted drug is like a highly trained sniper. It takes out one or two very specific targets that are driving the cancer. It's precise and effective. The herbs, on the other hand, seem to act more like ground support. They work more broadly, helping to regulate the body's metabolism and immune function. The result is a potential 1-2 punch against the cancer.
So let's zoom out. What's the big takeaway from all this? Why does this study matter for the future of cancer treatment?
This research really is a milestone. By using these super rigorous methods on a huge amount of real-world data over such a long time, it gives us the strongest evidence yet for a potential survival benefit from this kind of integrative medicine. It moves the conversation from anecdote to actual data, and it gives scientists specific biological pathways to go and investigate next. You know, the authors themselves put it perfectly. They conclude that their work provides, quote, critical insights for clinical application and research. Now, they're careful to say that more research is absolutely needed, like new clinical trials. But what they've done here is build this incredibly powerful foundation for both doctors and scientists to build on. And this leaves us with a really powerful final thought, doesn't it? For decades, the search has been for that single magic bullet to cure cancer. But this research suggests a different path. Maybe the next great breakthrough isn't a new discovery at all, but a new combination, intelligently weaving the incredible precision of modern science with the holistic wisdom of ancient medicine.